Hi all, I'm Dr. Malati, working as a professor in Tripling College of Nursing. So in this video, I'm going to discuss about the Pap smear procedure. Objectives are introduction, definition, indication and guidelines, equipments needed, pre-procedure, procedure and post-procedure, interpretation, limitations, health education, summary and conclusion. Introduction. Pap smear is a simple and effective screening test. It is used to detect the abnormal changes which happens in the cells of the cervix. It also plays a vital role in the early detection and also the prevention of cervical cancer. So the test involves collecting the cells from the cervix and examining them under the microscope for any precancerous or cancerous changes. So in obstetrics and gynecological practice, Pap smear is an essential component of a woman's health care. So regular screening helps in early diagnosis, timely treatment and reduction of morbidity and mortality. So it is safe, quick and cost effective procedure, and it is also widely recommended for all the women of the reproductive age group. Coming on to the definition. So it is a screening test for cervical cancer. So in this procedure, we will be collecting the cells from the cervix and for examination under the microscope. It helps to detect the precancerous lesions to prevent the cervical cancer. So the indications and guidelines are, so this procedure can be start at the age of 21 or within 3 years of becoming sexually active. So frequency is every 3 years for a woman aged between 30 to 70 years. Risk factors are HPV infection, multiple sexual partners, yearly sexual activity. So these are the indications and also the guidelines for this procedure. Equipments needed are speculum, that is Cuscus speculum, vulval swabbing set, mask, cytobrush or spatula, glass slides and fixatives, lubricants and gloves. This is the image of a speculum. These are the different types of sampling devices: brush, cytobrush, plastic spatula, wooden spatula. And this is a KY jelly, can be used for lubricating. Then this is a swab stick for collecting the specimen. This is also a spatula. Coming on to the nursing management pre-procedure. So we have to instruct the women those who want to take this test, instruct the patient to avoid the intercourse, douching or any vaginal medications priorly, that is 24 to 48 hours prior to this test. Then the ideal time for doing this procedure is between 14th to 28th day of the menstrual cycle, and we are not supposed to do this procedure during the menstruation time. Ensure the patient has not had a pelvic examination or any ultrasound examination in the last 24 hours. Coming on to the procedure steps, first and foremost is explain the procedure to the patient. Advise the patient to avoid, provide privacy, make a mother lying down in the lithotomy position, drape the patient and encourage the patient to take a deep breath. It helps for relaxing the pelvic muscles. And suppose if a doctor is performing this procedure, help to focus the torchlight and to open the set. Sometimes the nurses will be performing this procedure, means priorly we have to set, arrange all the torchlight and opening the set and all. Then thereafter insert the speculum to visualize. After lubricating, insert the speculum to visualize the cervix. Then collect the specimen from the transformation zone using a spatula brush. Then it has to be spread it on the slide and fix it immediately. Next, post procedure, observe any changes or else any discharge from the vagina. Assess the patient from the lithotomy position to the supine position. Document the procedure like date and time. Proper labeling the slide, patient name and ID number. Instruct the patient on potential mild spotting will be there and advise on follow-up care for the results. Interpretation are, so look into this image. It show you the normal, ascus, low grade, high grade and squamous cell carcinoma. So the normal means the interpretation. So after the testing, the result will give you like this. Normal means it will give you the negative. It means there is no identifiable infection. Ascus is nothing but presence of high risk infection with HPV. Low grade changes mean frequently due to infection with HPV, which in some instances can be a risk for a cervical development of a cervical cancer. Then high grade changes means very atypical cells that may result in cancer. Squamous cell carcinoma or adenocarcinoma, which is nothing but cancer, is very evident and requires immediate attention. So this is a interpretation of a Pap smear test. The limitations are, it is a low sensitivity, so we cannot able to detect in all the cases, and potential for getting a false negative, necessity of combining with HPV testing for accuracy. Health education, tell patient to inform any excessive bleeding after the procedure, instruct patient to follow up the procedure at least annually or biannually. Summary, a Pap smear is a simple, safe and effective screening test used to detect precancerous and cancerous changes in the cervix. It involves collecting cervical cells and examining them under a microscope. Regular screening helps in early identification of abnormal cells, infections and cervical dysplasia. It plays a vital role in the prevention and early diagnosis of cervical cancer, thereby reducing the mortality and morbidity among the women. Next conclusion, Pap smear is an essential cost-effective tool in women's healthcare. Early detection through regular screening significantly improves the treatment outcome and also prevents the progression of cervical cancer. Here, the nurses, we play a key role in educating the women, promoting the awareness and ensuring the timely screening, which ultimately enhances women's reproductive health and quality of life. References. Thank you.